All right, back to that developing news. Supreme Court Justice Ruth Bader Ginsburg recovering at Memorial Sloan Kettering Cancer Center in New York City tonight after having surgery to remove 2 cancerous growths from her left lung. Joining us now is Dr. Stephen Liu. He's an oncologist and lung cancer specialist with MedStar Georgetown University Hospital. Thank you so much for being here with us. Clearly, this is something that is serious. It is the 3rd time that she's fighting cancer. But tell us a little bit about what was found and what the surgery entailed. She's 85 years old, obviously, but she's in great shape for her age, still working, very active. How does a body like that respond to that?
Well, we don't have all the details yet, but it's likely Justice Ginsburg has what's called non-small cell lung cancer. That's the most common variant of lung cancer. And when detected early, a surgery such as the one she had is potentially curative. The surgery they described was removing the entire left lower lobe of the lung. There are 2 lobes on the left. Removing that lobe will reduce your lung volume by about 20%. But they've done preoperative tests to make sure that it's possible to do that safely.
And what does that mean exactly? Because when you think your lungs, obviously, helps you breathe. Is that going to affect how she breathes or how much activity she can go on moving forward? Or what's the prognosis?
So it will. There certainly is going to be some reduced pulmonary function, some reduced reserve. That's normal. But the rest of the lungs can compensate. You can recover from that. And for a surgery like this, using more modern techniques, generally patients are out of the hospital within a few days, back on their feet relatively quickly.
Does that mean any more treatments, chemotherapy, radiation, or does it seem like they were able to get in and get it out?
I think it's a little too early to know for sure.
Okay.
A lot of it will depend on the specific details after the pathologist looks at what was removed. But the most important part of the treatment is what was just done today.
And, you know, it was interesting how it was detected in Justice Ginsburg. She went in because she fractured her ribs after falling at the court, and then they saw this. Is this something that you can see for yourself or feel in your body, or does it largely go undetected until you're at the doctor's office for something else and this is when it's found?
So that's really the crux of the issue there. Our lungs are very well designed and they can tolerate large tumors within them without really causing any symptoms. And because of that, most cases of lung cancer in the U.S. are stage 4 when they're first diagnosed, about 60%, because a lung cancer that's very small won't cause symptoms.
Right.
If you're at high risk, a heavy smoking history, then a screening CT scan may help detect these at an earlier stage. But for most cases, when we detect a cancer such as this, when it's still localized, still small, it's usually picked up by chance.
So let me ask you, what is, I suppose, the survival, if you will, of something like this? Obviously, when people think cancer, as I think everybody does, you think what could be the end of your life, right? I mean, that's the first thing that people start to imagine. But it seems like as technology and medicine advance, there's a lot of ways to treat these things. Getting them out, obviously, is a first step, and seeking them treatment early, especially. But as far as lung cancer, is there a survival rate, if you will, for lung cancer? Is this something that will potentially happen again and reoccur?
Well, she is going to be at risk for this cancer recurring, and lung cancer is the most lethal cancer in the U.S. for women by far. So she will need to be watched very closely. Earlier stage is going to offer a better prognosis, and so she does have a good chance of being cured. Again, we need more details to be released from the surgery. The chance of the cancer coming back may be as low as 10 to 20%, maybe as high as 50. Depends on some of the details.
So again, this goes now to pathology. They will determine exactly what type of cancer it is, and then from there we'll know what sort of treatment Justice Ginsburg's in for.
The key is, was everything completely removed? Were lymph nodes involved? But yes, we should know more next week.
Dr. Liu, thank you so much for your expertise, and we wish Justice Ginsburg the best of luck in all of this.